what I'd like to do is start out by giving a little background on how we got to where we are right now, and then give an overview of some of the key components of our thinking in terms of the strategic refresh. And I should emphasize at the beginning that what I'm presenting right here is not cast in stone. What I'm presenting right here is the thinking of the many people who've come together to start forging the outlines and the framework of a strategic plan that will need to be filled in. And what we're going to be doing this afternoon or later on this morning is filling in those spaces and giving some depth and giving some content into this broad outline. Now, the question that is on the minds of a lot of people, especially when we began this process, is why do we even want to revisit our 2007 strategic plan? Well, part of it, as you know, is that this plan, or this recommendation to revisit the strategic plan, was one of the key recommendations to come out of the evaluation that took place in 2012. The coalition, as we've been saying over and over and over again during the course of yesterday, is a very different animal than it was in 2007 when we first developed our strategic plan. Not only are we maybe 10 times as large as we were in 2007, but in 2007 we didn't know what we would be capable of doing. We had no idea what to really be able to put into a strategic plan based on what we could do, because we really hadn't done that much up until that point. And so the strategic plan that was developed in 2007 was very aspirational. It wasn't based on what we knew we could do. It was based on a vision of what we would like to see the supplies arena, the reproductive health space look like in 5, 6, 7 years to come. And so it was a very broad strategic plan that focused really more on the means to an end rather than the end itself. And those of you who will remember our original strategic plan, we had 3 strategic goals. We had increasing the resource base for reproductive health supplies, we had strengthening the systems, and adding value to the work of our members. Well, those are not endpoints, those are means to an end. And so the recommendation that emerged out of the evaluation that took place in 2012 was a recommendation that came from the observation by the evaluators that much of what we eventually did achieve in the 5, 6 years afterwards was not enshrined in our strategic plan to begin with. And much of what was in the strategic plan and that we tracked through monitoring and evaluation was not necessarily things that we had a great deal of manageable interest or influence over. So there was a disconnect between where we saw ourselves going and the reality of the new environment and the reality of the new coalition. And so in Paris, based on the call by the recommendation of the evaluation, we met for the first time to begin taking stock of where we were, where our members would like to see us going, what it was that members of the coalition felt were our successes, what they would like to see us doing more of, and what they would like to see us doing less of. And this original material was brought together and served as the basis for a discussion that took place in March of this year, where we brought together representatives of our working groups and members of the Secretariat and others who were intimately familiar with events over the last 5, 6, 7 years within the coalition to really help us start looking on what it is that makes us tick. What were the successes that were discussed in Paris, that were included in the evaluation, that we really felt characterized the work of the coalition, and what was it about the coalition that made that possible? So for the first time, we were not only looking at our successes, but we were trying to get deeper and figure out the levers of change. What was it that only we can do? What was it about the way we're structured, about the way we work, that gives us some idea about what it is we could apply moving forward to achieve what it is we would like to achieve? And we identified what we call as the levers of change. We identified a number of levers of change that we agreed did capture the essence of what the coalition was all about. I'll mention a little bit more about those later on. So the next question is, great, we know what it is that makes us tick, and we've discussed many of these over the day yesterday, but that doesn't give us much of a vision. It's the mechanics, it's the nuts and the bolts and how things work. But the vision is something else. And so in June, we assembled a number of members of the executive committee. We brought together representatives of the regions, of Francophone Africa, of Latin America, and others to begin looking at the big picture. Where are we? What is the environment that we're dealing with? An environment that, as we know, as well has changed dramatically over the course of the last year. Where should we be? What should our vision and our overall mission be as we move forward within this very new context? And on the basis of the work of that group, we defined the future vision and we framed its constituent parts. Now here, again, I'll say a little bit more about those later on. We have the constituent parts, the pillars that we will mention: availability, quality, equity, choice. Those were what we ended up thinking of as the pillars that frame really our overall vision and represent key elements, constituent parts, prerequisites, if you will, to achieving our vision. So we ended up in September with vision, big picture, drawing from the meeting in June with the levers of change, and trying to figure out, or sorry, in June with the big picture, March with the levers of change. The question is, how do we link those two together? Where does that leave us? Well, where that left us was in September of this year, where, again, we went back to members of working groups, the leaders of the working groups, the leaders of caucuses, regional forums, and other implementing mechanisms to begin looking at that interface. Look at the interface between, on the one hand, the vision of where we want to go and what we want to do, and what we know are the levers of change that will allow us to say something and do something about that picture. And so on the basis of these broad notions of the pillars, broad concepts, choice, equity, quality, availability, which are very, very broad and go way beyond the manageable interest of the coalition as a whole, we use those levers of change to begin to start to think, if choice is critical, what is it that we as a coalition can do about choice? And based on what we can do about choice, what should our goal be? We can't take on all of choice, but there are certain things that we can do about choice, and that needs to be our goal. And the same is true with quality, equity, availability. So we define success based on that goal. If that is our goal, then how do we know to achieve that? What are the elements that would tell us that we have reached that goal? And once we start thinking about those prerequisites and what it takes to achieve those prerequisites, how do we tie it together in a sort of theory of change? How do the different pieces and the different parts all link together so that perhaps advances in one area can also trigger what's needed to get us to where we know in terms of goals? So this is the logic of how we've got to the point of where we are today. We have the pillars, we have an idea of the levers of change, we have this broad framework, and so today we're starting to put meat on the bones, and that is the work that will take place for the rest of this morning. I'm very happy that when this was presented to the executive on Wednesday, the executive committee meeting, we got a thumbs up by the board, that they were very much impressed by the work that's been done by so many of the people in this room, really over the course of the last year, to get us to this point. And so I'm excited now to be able to open this up for even a broader consultation, and I think based on the discussions that we had also in the executive committee meeting, it will be opened up even further to people beyond those in this room. So going back now to give you a little bit more of an idea of what we talk about when we talk about levers of change and pillars and everything else, on the basis of the meeting that took place in March with the working group leaders, and after looking at what we saw were our great successes over the last 9 years, 8 years, there were at least 6 levers of change. Actually, there were many more. There were many, many more when we got started. We figured it wouldn't be very helpful to have 13, 14, 15 levers of change. So we've tried to cluster them just for expedience sake into at least 6 here. But the first, of course, is the neutrality that provides a space for technical collaboration and problem solving. And I think we've seen that in so many of the activities that we've been engaged in. The ability to bring together a broad sector of players to get our members to leave their institutional hats at the door and really get down to the business at hand. It's allowed us to engage in discussions that I think we otherwise would not be able to engage in if people didn't have the trust that we are really dealing in a neutral space here. The convening power, the fact that we can bring together such a diverse group of people. Many of you will look at our website, and on the home page of the website there is a word cloud, and underneath it is sort of a description how everyone in this room is only 1 degree of separation from all of the really key decision makers in this field, and that's perfectly true. We bring together, we're able to convene, but we're also linked, and this relates very much to the 4th lever of change, able to help broker partnerships because we are just 1 degree of separation from key decision makers. We're also very much a brain trust. I mean, the reality is that the people in this room are the world's greatest thinkers and the most knowledgeable in this field. And so we do bring together a brain trust, really able to move the agenda forward. Flexibility. I think flexibility is certainly one of the things that I've seen as director of the coalition over the last 9 years, or 8 years, is that we have grown organically. We say we're a different institution than we were, 2006, 2005, and part of that is because we've been able to grow in response to the new realities that we see, and also the interest of our members. All of the new caucuses are really adaptations or our response to interest by the membership. They were never enshrined in the terms of reference or a scope of work. They evolved organically, and I think our coalition as a whole has evolved organically in response to the needs of members and the desire on the part of the members to respond to new realities. And last but certainly not least is our good name. And I think this is really one of the things I mentioned yesterday that underlies so much of where we see ourselves going in the future. The coalition is a respected name. It's a known entity. It carries weight. And part of that weight is what is really behind the work that we're now going to be doing in the 3 initiatives that we talked about: stockouts, market shaping, and commitments. When the coalition talks, people now listen, and that is a lever of change that we can use to our advantage in moving forward. In June, when members of the executive and others got together, we also looked at our vision. And you can see our vision statement in 2007 and our vision statement in 2013 as we proposed in that first meeting. And you'll see they're not very different. I think where you see a difference is that because the vision is supposed to be broad, we cast the net widely rather than limiting ourselves to low and middle income countries as part of our vision. Really, we're talking about all people. All people really should be able to have access. But we also were very cognizant of the fact that more recently we have been able to be truer to the name of the Reproductive Health Supplies Coalition by focusing much more on maternal supplies. That was not characteristic of the early years of the coalition, and increasingly with our maternal health caucus, that is becoming more a routine part of what we do. And so we were much more aware and redefining the vision to make the distinction between the broader reproductive health space and the particular need and the importance of choice, especially within the context of contraceptive methods. And we were also very cognizant, as is always the case when anyone develops a strategic plan, as you know, every word, every seemingly minor word is usually the product of hours and hours and hours of discussion. And so contraceptive methods was also a recognition of discussions that we've had with those who are working in the field of long-acting reversible contraception, who were quite critical of the fact that when we talked about contraceptives or just supplies, that we were not accurately reflecting what is needed to provide long-acting reversible contraception. To provide IUDs, for example, is a lot more than just that product. And so we were very cognizant of that in the vision. But as you can see, the vision has remained fairly much in line with what our vision has always been. Our mission, on the other hand, and this is the first time we have a mission statement that wasn't in the original strategic plan, is, what is it that we do? What is it we do to achieve that vision? And what it is that we do is we bring together this diversity of partners. And we do mobilize the collective strengths. That's what we're about. We're not about duplicating the work of our members. We're not about trying to do things that our members can do much better than we can. We're about bringing people together, adding value to be able to achieve that vision. And here is where we have the middle and low-income country. That is really what we are about. Our guiding principles. There were guiding principles in the original strategic plan, but we felt it was important to sort of look again and really narrow that down to a narrow, more defined set. And here you have the four that were felt to be especially critical. And one of those guiding principles is that we are committed to adding value to the work of our members. As I said, we are not about doing the work of our members. We are not about competing with the work of our members. We're not trying to outsmart the work of our members. We are trying to add value to what they do. We are committed to greater country ownership and leadership in meeting reproductive health needs. And this third is also fundamental, that we believe that sexual and reproductive health and rights are fundamental to ensuring equitable access and use of RX supplies, including informed choice of contraceptive methods. Again, sexual and reproductive health was not a phrase that was used in our original scope of work, and there was strong feeling that this is absolutely critical as we move forward. And lastly, the last statement, that we believe that access supplies is necessary but not a sufficient condition to achieve better reproductive health, is not a new idea, but we felt that it was important to highlight this idea, in large part because of really the success of our work over the last 7 years, 8 years. I think we've got to a point where now a lot of people, and I think many of you have seen this and a lot of editorials and comments, that people are now to the point where many are sort of saying, keep in mind, commodity security is not everything. I think that's a testament to our success, but I think it's important that we acknowledge that that's perfectly true. Commodity security is not everything. It is the bedrock of what is to follow. Without supplies, without no product, no program, is perfectly true. But it is by no means everything, and I think it's important that we keep that in mind as we look to the future. So, our vision, given what the vision is, we began looking at that, we began looking at our work, we began looking at the levers of change, and we agreed in this meeting in June that really our vision of ensuring access for better reproductive health really is predicated on the ability of women and men to have 4 things. To have quality supplies they know are both safe and effective, so this isn't just a technical issue, that they know are safe and effective. that they have equitable access to supplies, irrespective of their financial well-being, that they have a range of contraceptives and other RH options from which to choose, and we're not just talking about contraceptives here, and to avail themselves of a safe, affordable choice of supplies needed to meet their needs. And these are what we talk about when we talk about the fundamental principles, or the fundamental pillars, of our vision moving forward. So I'd like to go a little bit into more detail on what we mean then. These were the strategic pillars. And as I said, in September when we came together to merge the strategic pillars with the levers of change to help us refine, given the broad notion of choice, given the broad sense of equity, given all that's encompassed within its availability, we started to look, what is it that we can do? Given our levers of change, what within that broad scope can we as a coalition say is something that we will be working towards and would be willing to take responsibility for as part of all the work that's going on more broadly. And so the equity goal that was formulated is to reduce the financial and product-related barriers that marginalize populations from accessing the supplies they need to ensure their sexual and reproductive health. And when we talk about marginalized populations, it's any populations that are kept from or that confront barriers as a result of the financial issues or the financial constraints that they face or the product constraints that they face. And this encompasses a wide range of groups. It encompasses, as we all know, young people who face the financial constraints. It affects those living in rural areas who may confront product-related strains and financial-related constraints. Now, there are many things, and I think this is what's really critical. There are many things that sort of address the issue of equity. But again, our focus was really on trying to focus on what it is that we as a coalition can do. And then we started looking at the pathways of change. And the pathways, as they're defined here, really imply three things. One, they imply what are the things that need to happen for this goal to be achieved, and that we as a coalition have some control over, and that fall within the coalition's manageable interest to achieve over the next decade. And our strategic vision that we've set here is really a vision for the next decade. So taking into account those three elements, we identified three pathways of change. One pathway is better understanding of the total market, how everyone fits within the total market, that's looking at the constraints people face, identifying what populations are affected as a result of looking at the total market, and an appreciation by policymakers of the benefits to be derived from ensuring access for all. So this is really working with those in positions to be able to allocate resources, to be able to subsidize products if need be, to be able to create a more friendly environment for private sector to reach out to those who can afford to pay for commodities. These are the things that we identified that we are able to do to ensure that all populations have equity or equitable access to the commodities they need. Now again, there are many things that can be done, but what we wanted to do is we wanted to get away from the notion that what we were able to do was deal with the issues facing all rural populations, for example, or dealing with the problems that face all young people. What we're really trying to do is we're trying to focus on equity, and we're trying to focus on the levers over which we have some control. The same with equality. To ensure that women and men are able to obtain large supplies that they can believe are safe and effective by virtue of meeting agreed quality criteria. And this, I kind of reworded it a bit based on the discussion that we had within the executive committee. Originally, the goal statement was something to the effect that women and men know are safe and effective. Well, that's often a very difficult question. If someone is presented with a product, how do you know it's safe and effective? You don't know. All you can do is believe in some sort of system or believe in something that is telling you that the product is safe and effective. It presupposes that there is an awareness, that there are some sort of agreed upon criteria and standards, and that people know that there is a difference between products out there that are safe and products that are not safe. And when we look at the pathway to dealing with this issue, we see two separate pathways. We see one pathway that includes influencing the national policies and regulations that favor the provision of quality assured products, working with regulatory agencies, working with governments to put in place what's needed to ensure that quality products get into the country. But we also want to make sure that consumers as well are also aware. We don't want to just deal with this from the perspective of the regulators. We also feel it's important that consumers, that women know and can vote with their pocketbooks, with their feet, and choose products that they believe are safe and effective. The third strategic goal is to ensure that women and men can choose from a wider range of contraceptive and other reproductive health supply options currently available in the global marketplace. Now, again, as I said, each of these words are the product of hours and hours of discussion, but on this issue, one thing that I think is important by saying in the global marketplace is to dissuade anyone from believing that we are going to be about the development of new technologies. There may be an important role for the development of technologies, and many of our partners in this room are doing that, and they're doing an incredible job of that. But as a coalition, that's not our strength. And so really what we're looking right at here, again, is we're looking at a pathway that is there to ensure that there is a full range of products available, that there is a consensus over what we mean by choice, that there are global and national policies in place to support choice, and that there is financing in place to make possible greater choice. And last but not least, and maybe even should be the first, when we had the discussion with the executive committee, a member of the executive committee asked, well, why is availability last and quality is first? And it's purely accidental, there's no reason. And in fact, if you look at availability is what in fact is really, I think, encompassed probably the bulk of the work that's taken place within the coalition to date, and that of many of our members. And really it is about ensuring the availability of products from manufacturers through supply systems to point of access. It's about getting product into the system, and it's getting products through the system into the hands of those who need it. And what do we need to ensure that? We need to ensure a full product pipeline. We need to make sure that there are national supply systems that are functioning and performing well. And we need a policy environment that's conducive to efficient supply chain. It's not just a technical fix, it's also making sure that governments believe in the importance of this and are willing to take the tough decisions that they need to take in order to make sure that the systems are working well. So when you look at the pathways, the question becomes, what do they all have in common? Now, each of these pathways are pathways that were identified to get us to that particular goal, choice, equity, availability, and which one? Quality. But we don't want really a theory of change that is nothing more than four parallel structures. Because what we do, and I think we've seen that over the course of the discussions over the last day, is everything that we do is interrelated. And so what do these pathways have in common? Well, one thing is they're all based to some degree on forging national commitments. It's about getting governments on board, not necessarily commitments as in sound bites at international conferences, but getting governments committed to making the changes and putting in place the policies that are needed in order to improve the environment for quality, in order to ensure pipelines are filled, in order to ensure that supply chains are working effectively. It's about strengthening international commitments, and that's the donors, that's the International Technical Committee, it's manufacturers, it's everyone that's working to increase the resources to support the policies and to provide the technical support. And that may be technical support to improve human resources and professionalization of supply chain workers. Filling the product pipeline with quality products, that is indispensable. If you don't have products in the pipeline, you're not going to achieve what needs to be done. And there are lots of ways of filling the pipeline. We need to make sure that manufacturers have an interest and want to produce, that they feel that there is going to be economic gain to them, that there are markets out there for their products, and that the markets are going to be visible. Product pipeline touches on so many aspects of what we're looking at here. It has implications for manufacturing, it has implications for so much. The same with understanding the total market. Total market is also a common pathway. Understanding the total market will help us address areas related to equity, to resource allocation, to so much. And last but not least, reaching out to consumers. I know consumers is not exactly the best word to be referring to the women and men who access reproductive health supplies to improve reproductive health, and maybe we can find a better word than that, than consumers, but I think you know what we need, that what we're working at is not just to change policies and regulations at government level. What we want to be able to do is reach out to people, and people who are making decisions, and whose lives we're working for. And so if you look at these common pathways, if you look at these common points of intersection, it leads us to a very rough, and as I said, this is very rough, very tentative, a theory of change that really gives us some sense of how all of the things that we've been talking about in terms of pathways can lead us to where we want to be in terms of indicators that tell us, are we achieving success with regards to the goal, and the goal as it relates to each of the broader pillars. And just to take, for example, the issue of quality. There were three things that we mentioned in terms of the pathway. One is making the business case for all of the strategic pillars, but particularly in this case, in the case of quality, it's demonstrating why does quality make a difference. How can quality help governments save money? How can quality help governments ensure the health of people in the country? Why is it important? Both from an economic perspective, from a rights-based perspective, it's making the case for quality at country level, which we see as increasing government and national commitment to quality, putting in place the right mechanisms and policies in order to be able to move that forward. But by the same token, above that, we have consumers given the means to demand quality and know the difference. So if we've got quality supportive policies implemented by committed governments, and we have demand built for quality products among consumers, those two pillars, I think, encompass much of what we as a coalition are able to do to take us along the way towards making a difference in the quality space. Now, that doesn't exhaust everything that has to do with quality. It doesn't touch on quality of care. It doesn't touch on the technical side of helping manufacturers to achieve pre-qualification. We have members of the coalition who are doing an excellent job of that. Again, the focus is very much on what we as a coalition can do to bring about change in these areas. So, I hope that has given an overview of the thinking and the discussions of the year. There is a lot of consolidation that has gone into this, as any of you know who's worked on strategic planning in the past. At the end of each session, you end up with dozens and dozens and dozens of flip charts and post-its and sticky cloths on the wall. But I think this distills it to its essence. And so I look forward to the discussions this morning so that everyone here can add some meat to the bones and perhaps raise issues that haven't come.